So, Dr. O'Bear, let's change our conversation a little bit and let's talk a little bit about the sling and how it actually treats and helps patients with incontinence. And is this a big surgery when patients are inquiring about this?
Well, we talk about slings. When we talk about slings, we're speaking on what we call female stress incontinence. And female stress incontinence happens usually from damage to the pelvic floor from either childbirth or from repetitive heavy lifting or just chronic stress over time. And what essentially happens is they lose support of the pelvic floor. And as that support is lost, there's not enough support for the urethra to actually maintain coaptation or closure during what we call these Valsalva movements. So anything that causes you to lift something that would make you would lift something heavy, if you would cough or sneeze, or if you were out with your kids, running, jumping on trampolines, lots of those things would cause actual urine leakage. So when we use slings to actually improve the pelvic support and increase the tension underneath the bladder and the urethra area so that that support is restored and that continence can be regained.
So, is every patient that has urinary leakage, are they all candidates for this sling?
No, no. There are multiple types of urinary leakage. You know, the one we just talked about was what we call stress incontinence. There's another type of incontinence called urge incontinence, and this is the one you see the commercials for on TV all the time. The commercial with the bladder and you gotta go right now. And urge incontinence occurs when there's an involuntary bladder contraction. And the main way of treating those, or the initial way of treating most of those, are medications. However, there are surgical procedures that can treat urge incontinence as well. And those include either Botox injection into the bladder to cause a slight paralysis to slow down those contractions, or there's another novel treatment, something called an InterStim, which is a nerve stimulator, sort of a remote control for your bladder that stimulates the bladder to contract less. And both of those are options as well.
So, Dr. O'Bear, in regards to these treatments and these procedures for incontinence, how soon will the patient actually receive a result from this procedure?
Well, with patients with stress incontinence, those slings can actually cure the patient almost immediately. When a patient wakes up from sling incontinence, she is usually completely dry. It can take some time, a few more weeks to months to get final improvement, but they should notice an immediate improvement. The same thing with Botox injection as well as the InterStim treatment for urge incontinence. Those patients get almost immediate improvement, if not resolution. So these procedures do help, and they help right away.